Hi, and good day. I want to talk about myofascial syndrome. Myofascial syndrome is a syndrome of pain that's usually localized to a different origin or a different site from where it's coming from. In other words, there's fascia that covers obviously many organs and tissues in the body, but predominantly muscle we're talking about. The fascia covers the muscle. The number one cause is forward head posture. Rounded shoulders, looking down. Sitting at a computer, looking down with your kind of work, commonly seen with physicians, dentists that look down all day long, even massage therapists that spend a lot of time looking in a downward position for long hours daily. Anything that you're doing repetitively over long periods of time, the muscles have a tremendous amount of tension and stress on them, and eventually the muscles then send referred pain to the fascia within different areas of the body. Now, what are the main causes? Anything repetitively to a muscle, a tendon, which is part of a muscle that attaches into a bone, a ligament, which is what attaches in a joint from bone to bone, but whenever there is excessive stress to an area, there is going to be usually a myofascial component. Now, with this myofascial component, it's not only from an injury or chronic repetitive movements, but even involvement to a disc, like a herniated disc, a bulging disc, can then refer pain to a myofascial area. Now, there are certain points in the body that you can touch, and you can put your finger in there, and you can feel pain in a different area. Now, the question you may have is, how do you treat this underlying condition? Well, the first thing is you have to remove the causation. If you're spending a lot of time in a forward head posture, rounded shoulders, if you're doing something that's cumulative trauma disorders, doing something repetitively over and over and over, and you're overutilizing and working the muscles, you need to stop that, or the condition is not going to go away. So how is the condition treated? Obviously, number one, stopping the causation of what's causing it. Number two, trigger point myofascial release can be done with a therapist, a physical therapist, massage therapist, chiropractor. And there's another technique called spray and stretch, where we would actually utilize a spray over the area to temporarily numb the surface of the skin, and then we obviously stretch the fascia. Understand, when there is myofascial involvement, the body has a tendency to lay scar tissue, which is fibrous tissue. Now, fibrous tissue is not the same as normal collagen tissue. So collagen tissue, you can look at it as a rubber band where you can overstretch it and it can come right back. But obviously, fibrous tissue or scar tissue doesn't have that normal durability, doesn't have that elasticity. So obviously, when a person is moving their neck or doing it, putting their joint into a position, predominantly in the upper back and the neck of the shoulders, the fascia doesn't want to stretch, leading to more inflammation and obviously lots of pain. So if you have any questions, feel free to contact me. Make it a great day. I'm Dr. Alan Mandel.